There's a gentleman there that's had his hand up quite a few times. I don't know.
Vitamin D appears to be a treatment for a lot of different diseases. Is there any known common bond between these diseases?
No, as I was trying to tell you, vitamin D is not a treatment for all of these diseases, but the survey data indicate that in places where there's higher vitamin D production or intake, the incidence of those degenerative diseases is lower. Now, what we're trying to do is develop a modification of vitamin D that can be targeted for that particular disease. We're trying to do that, but haven't achieved it yet. Am I getting through to you? I'm not sure.
I guess I was wondering if there was a connection of these diseases. There's something common that...
Many of the autoimmune diseases are common. The question is there any connection between all these diseases that vitamin D could be used to treat, if I understand your question right? The answer is yes. In the case of autoimmune, there is a thread. You're trying to suppress the inflammatory reaction that's occurring. In all cases of those, it's the inflammatory disease that destroys your tissue. And what you're trying to do is suppress the inflammatory reaction. And vitamin D appears to do this at the expense of hypercalcemia. So again, what we're trying to do is breed out the hypercalcemia but retain the ability to treat the immune cells.
Dr. DeLuca, is there any, what causes hypercalcemia?
Okay.
Did I miss that in your lecture? If I did, I'm sorry.
Yeah.
Can you just repeat simply what causes it?
Yes, the question is what causes hypercalcemia? Vitamin D, the active form of vitamin D, turns on the small intestine to absorb calcium against a concentration grade. In other words, it will concentrate it from the intestine into the bloodstream. If you don't have enough calcium that way, it will work together with parathyroid to mobilize it from bone. And a small amount is good. It raises blood calcium to normal. That's required for mineralizing the skeleton. However, if you overdo it, you pump too much calcium from the gut into the blood, you mobilize too much calcium from the bone, you raise calcium above normal. Now, blood is normally supersaturated with calcium and phosphate. That's the state of events that's needed to support neuromuscular function and needed to mineralize skeleton. But if you go above that, it makes blood a metastable solution, and you start wanting to crystallize that calcium and phosphorus out for places where you don't want it. Kidney is a favorite site because there you're concentrating urine, you're making it even more concentrated, and you start depositing mineral in kidneys. Then you begin to block the function of the kidney tubule, and you start getting kidney nephrosis. You start dropping calcium in the heart muscle, blood vessels. You start dropping calcium even in the subcutaneous part of your body, which isn't as dangerous as it is in the blood vessels. So when you start calcifying too much of your tissue, you start destroying function, it's going to be lethal.
So what do you do to bring it down?
Well, there are a lot of things. If you have hypercalcemia, besides looking for the reason for it, first you got to suspect vitamin D intoxication, primary hyperparathyroidism. But if someone comes in and presents with hypercalcemia, doctors will usually try washout procedures, will give you a diuretic to make you, bring it down into the normal range. And you can even be treated with glucocorticoids or cortisone-type drugs that will block the action of vitamin D and block calcium transfer. And that brings it back into the non-dangerous range. But it is, our body normally has a protection against hypercalcemia. There's another hormone that's secreted from the thyroid. It's called calcitonin. And when blood goes too high, it triggers the secretion of that hormone. And one of the things that this hormone does is goes to the bone and stops the osteoblast from pumping calcium back into the bloodstream from bone, and that brings it into the normal range. So there are a number of drugs that can be used to help you against hypercalcemia if you detect it soon enough. Of course, you want to get the primary reason. If you can't come in with hypercalcemia right away, someone's going to order a measurement of 25-hydroxy vitamin D in your blood. They're going to measure, look at a measurement of parathyroid hormone, and right away that's going to tell you two very possible reasons why you've got hypercalcemia. If it's vitamin D intoxication, you're going to go on diuretics and a glucocorticoid. If it's parathyroid, you're going to look and see whether you have a primary adenoma and are you a target for surgery. That's the other option.
Any questions on this side of the room?
What role do you think that vitamin D plays in depression or prevention of depression?
Ooh,